Today we will talk on constipation medications in children, the different types, how they work, their potential side effects, and answer some of the questions parents ask me. Will my child get dependent on the medication? Are there any natural alternatives? But first, we will recap how our digestive system works. In the mouth, the food that we eat mixes with saliva. The stomach, the food mixes with gastric juices. Small intestines digest and absorb proteins, fats, and carbohydrates. Large intestines absorb water from the stools, making them bigger and harder, and the rectum acts as the stool's temporary storage. The longer the stools sit in the rectum, the bigger and harder they get. The normal rectal tone is lost, and the rectum starts stretching. This condition is called megarectum. As the constipation gets more chronic, this can cause a lack of sensation, and some loose stools can leak through, which is called overflow incontinence or soiling. When using constipation medicines, however, I always recommend talking to your doctor so they can advise you on the right medicine. One of the medicines often prescribed is lactulose. Lactulose is actually a man-made sugar. Its intake increases the sugar buildup in the intestines, pulling water out into the gut, making it easier for the stools to pass out. Lactulose may take 48 hours to work, but I don't usually recommend lactulose for long-term use, as firstly, it's a combination of sugars, and secondly, it can change the intestinal bacterial flora. Macrogols are the commonest medications that we use in children for constipation now. Macrogols bring water to hard, dry stool, and the water retained by macrogols softens the stools and bulks it up slightly. As the stool gently expands, it increases colonic activity and bowel movements. Because of the lubricating effect of macrogol and the hydrated soft stool, the bowel movement now feels more comfortable. Senna is a natural laxative made from the leaves and fruit of the senna plant. It works by stimulating the muscles in your gut. Sodium picosulfate is also a stimulant laxative that works by stimulating the nerve endings in the walls of the large intestine and rectum. In some children with chronic constipation, we use a combination of medications, that is, both stool softeners along with stimulant medications. This is so that the stools can pass effectively and hence improve the tone and sensation in the rectum. Occasionally, we do use glycerin suppositories, which can actually work quite well in small babies for temporary relief. Stronger enemas in children should only be used in discussion with your pediatrician. For more information, please do subscribe and watch the rest of the videos on our constipation channel, which include practical tips and fun ways to give your children laxatives, as well as information on the causes of constipation. Thank you for watching.